Hello there, Pattaya. It's Dr. Ian at the Bangkok Hospital, Pattaya. And this is one of our HealthWise programs. With me is Dr. Tappersit, who is a prosthodontist here at the hospital. Okay. Dr. Tappersit is the man who puts teeth back. Tell us a bit more about that, Dr. Tappersit.
Well, putting teeth back involves a couple of things. Traditionally, it's been kind of a removable prosthesis sort of thing, except in the past 20 or 30 years, it has graduated into something more sophisticated. And what I'd like to talk to you about today, or the audience rather, today is about dental implants. Right. Dental implants are indicated in cases where patients are missing teeth, and usually in a case where there's no teeth in the back. Mm-hmm. 20 or 30 years ago, the only option would be to put a bridge, a fixed bridge, or a removable prosthesis to restore this area here. But more commonly, people have problems with missing teeth in the back. So instead of, there's no anchor in the back, obviously, so we're going to have to put something in. In this case, dental implants comes in play. This was invented about 30, 40 years ago by a Swedish dentist. Mm-hmm. It's only became mainstream in the past 20, 25 years. Usually it's about 5 millimeter diameter and about 11 millimeter long. It goes directly into the bone. This is bone. Just assume that the teeth are not here. And the dental implants go directly into the bone here. And it's left there for about 2 to 3 months, allowing bone integration to be completed around the implant fixture. Yes. And after that time, the top part of the implant is placed. And then the crown goes on top of it.
What is the pain factor like in this procedure?
Most of the patients that we have treated in the past surprisingly have very little post-operative discomfort.
Of course, with all new technology comes the new pricing.
Yes.
I would imagine this is not an inexpensive exercise.
No, this is probably the most expensive treatment in dentistry.
Now this is, as I said, I'm petrified about teeth, dentists and everything else, but undoubtedly to have something like that from the patient's point of view, it would feel like a normal tooth.
Yes, it would.
As opposed to the bridge where they can always find the wire with their tongue and things like this.
So some of the drawback of traditional dental treatment, i.e. removable prosthesis, are the little hardware that comes with it. Clasp and acrylic and stuff across the palate, that sort of thing. Also, when you make traditional bridges, it involves grinding down adjacent tooth structure, and sometimes they're healthy teeth.
Right. Finally, how long can the patient expect their implant to last?
Well, there are quite a few factors involved, but mainly one on the ability of the technical skill of the one who puts it in, 2, the patient's health, and 3, compliance with what he needs to do, i.e. not smoke, brush and floss and all that stuff. You have to treat it like a real tooth. I've had a patient, rest his soul, passed away about 3 months ago at the age of 95. Now, as a matter of fact, he's an ex-dentist from Albany, New York. I think some of our audience may know him. Passed on a few months ago. He had his implants placed back in '68.
So, in other words, they do last a long time.
And he took it with him.
Right. Dr. Tappersit, thank you very much. And if you are interested in seeing somebody here at the hospital, we have a fully equipped dental centre, and they will be able to explain to you everything about dental implants. This is Dr. Ian saying